Arterial hypertension is a pathological condition characterized by the constant presence of high blood pressure in the arteries, which is determined by cardiac output, the force of contraction of the heart muscle, and vascular resistance. We speak of arterial hypertension when the minimum or diastolic pressure is greater than 90 millimeters of mercury, and the maximum or systolic pressure is greater than 140 millimeters of mercury. Hypertension is one of the main risk factors for cardio-cerebrovascular diseases, such as myocardial infarction and stroke, but also for chronic renal failure and retinopathy. In the last video, which you can find by clicking here above, we saw what to do to lower blood pressure naturally without using medications. In this video, however, we are going to see what are some foods that help lower blood pressure. The D.A.S.H diet, acronym for Dietary Approaches to Stop Hypertension, is a diet promoted by the National Institute of Health of the United States in order to help prevent or improve high blood pressure, as well as reduce excessively high levels of cholesterol and triglycerides in the blood. Banana. Bananas are among the most loved and consumed fruits in the world, thanks to their sweet taste and their nutritional properties, thus reaching an annual world consumption of around 114 million tons of bananas. According to some studies, the consumption of bananas helps to lower blood pressure as they are rich in potassium, one of the minerals most present in the body, which in addition to regulating the balance of cellular fluids and muscle contraction, including that of the heart muscle, controls blood pressure. Potassium helps reduce excess sodium in the body, thus counteracting the negative effects that a high-salt diet has on blood pressure. Not only that, the intake of a sufficient amount of potassium serves to prevent arterial stiffness, that is the condition in which blood vessels lose their natural elasticity, and therefore increases the risk of developing hypertension and some cardiovascular diseases. Bananas are among the fruits richest in potassium and contain about 350 milligrams for every 100 grams of edible portion. However, there are some fruits that have more, for example currants with 370 milligrams of potassium per 100 grams, kiwis with 400 milligrams, and at the top of the ranking we find avocado with 450 milligrams. Cocoa. The pods are the fruits of the cocoa plant, called Theobroma cacao, an evergreen tree with an average height of 5 to 10 meters, originally from tropical America. Each pod contains from 25 to 40 seeds, called cocoa beans, which are immersed in an abundant sugary pulp with a gelatinous consistency. Following the various stages of processing, the chocolate is then obtained, which we then find on sale in the supermarket in the form of bars. According to some epidemiological studies, products rich in cocoa reduce the risk of cardiovascular disease thanks to their flavanol content, secondary metabolites produced by plants, and flavonoid subgroup. It has been shown that the flavanols present in cocoa increase the formation of endothelial nitric oxide, which favors vasodilation and consequently the reduction of blood pressure. Effects that were also found 8 hours after cocoa consumption. According to the researchers, the explanation could be due to the way in which bacteria in the intestine metabolize the flavanols in cocoa. However, to benefit from the properties of chocolate, experts recommend choosing the dark one with at least 70% cocoa. Oats. Oats are a herbaceous plant of the gramineaceous family native to Asia Minor, whose grain is rich in fiber, vitamins, proteins, and many other nutrients. It is therefore a precious cereal for the well-being of our body, and being rich in fiber, it helps to lower blood pressure levels, both systolic and diastolic. We are talking in particular of beta-glucan, a soluble dietary fiber that we find mainly in oats and barley, and in smaller quantities also in rye and wheat. According to some studies, the addition of whole oats in one's diet can be an effective dietary therapy in the prevention and adjunctive treatment of hypertension, as well as in lowering the level of total and bad cholesterol. Garlic. Botanically, garlic is neither a spice nor an aromatic herb, but a vegetable that grows underground. Its bulb is used in the kitchen as a condiment and in medicine as an antiseptic and vermifuge that is capable of eliminating parasitic worms from the intestine. The active ingredient in garlic is diallyl thiosulfonate, better known as allicin, a chemical compound containing sulfur which gives it its characteristic pungent odor. Garlic supplements, particularly allicin, have been shown to be effective in lowering blood pressure in hypertensive patients, similar to standard first-line antihypertensive drugs, as well as reducing arterial stiffness, high cholesterol levels, and the viscosity of the blood. According to a study published by a group of Melbourne researchers, the sulfur compounds contained in garlic help to modulate the production of nitric oxide at the level of the endothelium of the blood vessels, inducing a relaxation of the smooth muscles of the arteries and therefore a reduction in blood pressure. Allicin is also able to inhibit the activity of the angiotensin-converting enzyme, an important protein hormone, which has the task of increasing blood pressure through vasoconstriction, that is when the diameter of the blood vessels is reduced. Low-fat dairy products. Among the dairy products with a low percentage of fat, we find skimmed or partially skimmed milk, low-fat yogurts, and low-fat cheeses, that is those that have a percentage of saturated fats of less than 20%, such as cottage cheese. Following the result of some studies, it has been found that consuming low-fat dairy products can lower blood pressure. The beneficial effects on hypertension are to be attributed to the bioactive peptides, that is small fragments of protein obtained from the digestion of whey, which inhibit the angiotensin-converting enzyme, causing a relaxation of the blood vessels and therefore a reduction in blood pressure. Dairy products are also an excellent source of calcium, phosphorus, and magnesium, which can affect vascular resistance, promote vasodilation, and help counteract hypertension. Omega-3 fatty acids. Omega-3s are polyunsaturated fatty acids that are very useful for preventing cardiovascular disease and some inflammatory diseases. They are also called essential fatty acids, as they are essential for the correct functioning of the body and cannot be synthesized by human cells but must be introduced through the diet. Among the foods of animal origin richest in omega-3, we find salmon, mackerel, tuna, sardines, anchovies, swordfish, and cod, while among those of vegetable origin, we find walnuts, seeds, and chia oil, of flax and hemp. According to some studies, the intake of omega-3 significantly reduces systolic and diastolic blood pressure, as well as having beneficial effects on cardiac and vascular function, blood coagulation, immune response, and cardiac rhythm. Dietary omega-3 fatty acids are associated with lower levels of inflammation and improved endothelial function in cardiovascular and other chronic and acute diseases. However, the Italian National Institute of Health reminds that pharmacological therapy to treat hypertension cannot and must never be replaced by the intake of the foods we have just talked about in this video. Although they are natural foods and free from side effects, they absolutely cannot replace medications, which have now demonstrated their effectiveness in an impressive amount of research all over the world, reducing the risk of stroke by 1/3 and by about 1/5 that of coronary heart disease.